providing interpretation at this meeting. And so if you would like to listen to the meeting in Spanish, we are really grateful Sandra is interpreting for us today. So thank you, Sandra. And at the bottom of your Zoom screen, you can click on the interpretation button, which is over to the right, and click interpretation, and then you will be able to listen to the meeting in Spanish. And then if you only want to hear the interpretation, you can go ahead and mute the original audio. It's one of the features that we've been playing around with lately. If you want to kind of dampen my voice and hear Sandra's voice louder. Next slide, Christina. And so just a reminder for when we are interpreting our meetings, we ask whoever's speaking, whether you're a presenter or asking a question, to pause between sentences or complete thoughts to allow Sandra enough time to complete this interpretation for the sentence she's interpreting. We can hear everybody in the main channel except for Sandra. So just a reminder about that. Again, you can choose the channel of your language preference. And we are offering transcription today. So if you'd like to see the transcription of this meeting, just click the live transcript button at the bottom of your screen. However, you can only hear the transcription in English. Next slide, Christina. Okay, so just a reminder before we get rolling with the meeting today, our collaborative is a program of the Tahoe Truckee Community Foundation, and we are comprised of 46 health, education, and social service agencies and nonprofits who work together to address the fundamental needs of children, families, and all residents in the Tahoe Truckee area. Next slide, Christina. We have adopted the Annie E. Casey Foundation meeting guidelines that are specifically for having conversations around race and equity. However, we have found them to be very helpful to guide all of our conversations. So I'm going to read through them very quickly. You have seen these before. So the first meeting guideline is bring your best self. Number 2, be an active listener. Number 3, be kind and generous. Number 4, stay engaged. Next slide, Christina, thank you. Be open and suspend judgment. Speak your truth. Lean into discomfort. Enable empathy and compassion. And expect and accept that there may not be closure. And if you'd like a copy of these slides or the meeting guidelines, we are happy to share these with you as well. So our agenda for today, we are going to do a very quick icebreaker. If you could also put your name and agency in the chat box. And for today's purposes, I would love to ask you all if you could change or add your agency to kind of like your name tag on your Zoom box. We're going to be doing a number of small group breakouts later on, and it will help our facilitators as well as everyone in the meeting to understand and to have awareness of the agencies that are participating today. So if you could go to the top of your Zoom box, and there's 3 buttons, and all you need to do is scroll down to the bottom of that screen. It says rename. So if you could just put your name and again, your agency or an acronym. So again, top of your Zoom square, 3 little dots in the upper right-hand corner, scroll down to that drop-down menu and hit rename. So again, I just put Alison Schwedner Community Collaborative. And if that's not showing up on your Zoom screen, that's okay. But again, I thought it would be helpful just so we all know who's here today. So after we do a quick icebreaker, I'm going to turn it over to Beatrice Schaefert, who is our Child Abuse Prevention Council Coordinator, who just wants to check in with you all about something. And then we're going to spend the bulk of the time talking about our behavioral health roadmap rollout and getting feedback from you all. And so thank you very much to all of our facilitators who are joining us today. And we will take about a 5-minute break between after I present the findings from our behavioral health roadmap before we break out into small groups, because the small groups are a little bit complicated today. We have a number of small groups. We're using a technology called Padlet. So we want to make sure that during that 5-minute break, we have time to check in with the facilitators about how those small groups will work and answer any questions. So just so you all know, we'll have about a 5-minute break around, I'm thinking 10:45 or so. So that is our plan for the day, and then we will wrap up with resource sharing, where you will all have an opportunity to share any program highlights, any going on in your organizations that you would like the rest of the partners to know about. So as far as icebreaker goes, it's very quick. We have done this before, but in our never-ending efforts to prevent and kind of combat any vicarious trauma. We are going to break out into small groups, and we're asking if you could find your phone if it's near you, or if you don't have your phone with you, if you can find like a photo or something in your workspace that brings you joy. And all we're going to ask you to do is share your name, your organization, and then you can share your phone and whatever the photo that comes up that brings you joy, or the object if you don't happen to have your phone. And one of the conversations that we've been having a lot with many of you is that it's just been a very it continues to be a challenging time. I know that there's been quite a bit of loss in our community over the last several weeks. We know that the international news and reading about what's happening in Ukraine is very challenging and hard to read and hard to witness. And so again, we always just want to do what we can as a collective to build our collective resiliency and again, prevent vicarious trauma, whether it's on a personal level, professional, global level. And again, it's so important to take these moments together to focus on things that bring us joy. So Christina, at this point, I will turn it over to you. So we're going to do really quick small group breakouts. So maybe like 5 minutes. If people have, get through with their sharing within 5 minutes, you can get up, stretch, and get your coffee or whatever, but we'll come back together at 10:15. Does that work, Christina? Great, thank you. Okay. Well, I hope you all had a moment to reflect on something or somebody or something going on in your life that brings you a little joy. So I will turn it over to Beatrice, and thank you for joining us, Beatrice, to talk about Child Abuse Prevention Month.
Thank you, Alison, and thank you for, I feel grateful for this time. Again, my name is Beatrice Schaeffer. I'm coordinator for Community for Kids, but is also known as the Child Abuse Prevention Council. And for those of you who are not familiar with our work, our council focuses on supporting programs that supports the wellness of children and teens in our community. Some examples of this work is funding educational materials like the period of purple crying delivered by the Tahoe Forest Hospital. But there's also sometimes opportunities for capacity building in supporting all the work that you guys do. But really, the bigger picture of this work is to provide awareness. So with that in mind, I'm here today because we would like to ask for your support. Next month, April, is the National Child Abuse Prevention Month, and we would like it if you can help us raise awareness. There are going to be several ways that you guys can support these efforts. Christina is going to be sharing some of those options momentarily. If you have any questions about any of the options, please feel free to reach out to me. Christina will be posting my contact information so that I can answer any questions. I do want to clarify, there is one of the options there about promoting Be the One campaign. Thank you, Christina. Maybe I can talk about it right here. So the first one is Wear Blue Day, which is the national day where we all get to wear blue. It happens to be my favorite color, so I think I'm going to wear it all month long. But here you can participate individually, or you can participate as completed with your agency. Be the One campaign is about being that one for that person, whether it's your neighbor, a work colleague, a child. Being the One is educational materials with a message. I'm going to be providing, for those who want to participate in the Be the One campaign, those materials for social media posting, as well as paper distribution materials. There's community walk. Let's walk together wearing blue. There's nothing like a big group of people showing efforts. We're going to be walking in both Truckee and Kings Beach. I'm very excited about this one. We can all wear blue and make a statement. Here are the dates. The Truckee location is yet to be confirmed, but I'm happy to connect with those who would like to join us. And finally, there is an opportunity for some outreach and distribution of the Be the One campaign during Earth Day. If any one of your agencies are already participating in Earth Day, which is going to be at the Palisades Tahoe, April 23rd, if you can help us support and distribute some of those flyers or just have them available for families to grab, that would be incredibly helpful. Again, please let me know if you have any questions, and we are excited to combine efforts and do this work together. Thank you.
Thank you, Beatrice.
Great, thank
Okay,
you. I'm going to end the poll. So if you haven't voted, I'm going to give you about 10 seconds to vote, and then I will close it.
I like that. Voting under pressure. It's really good. We're up to 53% of folks have voted. That feels good. Okay, we'll give folks a few more seconds. So Christina, let me know when you end the poll.
I ended the poll, Allison.
All right, thank you. All right, thanks, Beatrice. Well, I look forward to seeing where we land as a Child Abuse Prevention Council, and we can definitely bring that information back to the broader group. So thank you so much. All right. So Christine, if you wouldn't mind sharing your screen again, and we'll start talking about what we're going to do today. So we do have a slide deck in both English and in Spanish. So to see the slide deck in Spanish, if you can go to the top of your screen where it says View Options and scroll down to see slides in Spanish, which is right under shared screen. So you should be able to see it there. Let us know if you have any questions. Sorry, my Siri is talking to me for some reason. I'm not quite sure why. Let me get rid of her. She has a lot to offer. Okay, so any questions from anybody about seeing the slides in Spanish? Is everything working? I just want to take a pause to ensure that our technology is working before we get rolling. Okay.
I believe we are good.
Good, awesome, thank you. Okay, and then again, for folks that are just joining us, if you could go ahead and put your name, your organization in the chat box, and if you also wouldn't mind changing your name on your Zoom box so we know who you are and what organization you're representing, that would be really helpful. Okay, next slide, Christina. Okay, so our goal for today is to share the work that we've been doing as a collaborative and in partnership with most of you, with many of you, specifically around behavioral health. So next slide, Christina. So why are we talking about mental health, and why are we focusing on mental health and behavioral health as a collaborative? So I'm just going to spend a little bit of time talking about, again, the why of the work before I get into the specific activities we've been doing. So as we all know, mental health challenges are totally normal. We all experience mental health challenges from time to time, and there is certainly a continuum of mental health needs. When you look at behavioral health issues, so ranging from like mild anxiety and depression to more severe mental health issues such as bipolar disorder or schizophrenia spectrum disorders. So many of us experience mental health issues along that continuum at any point in our lives. We also know, and what we've learned, is that mental health issues are exacerbated in rural mountain towns for a number of issues. We often experience more isolation than our counterparts do in more urban areas. We tend to lack the more complex and broad range of services and the continuum of services that more urban areas offer. And as a result, we tend to be kind of under-resourced in services as well as funding. And specific to Tahoe, although this is not specific just to Tahoe, there's other regions that have this challenge, is that we have a very fragmented system in general, not just for behavioral health, but for all of our services. So we have the California-Nevada state line that bisects Lake Tahoe. We have multiple counties on the California side, and we also have a number of special districts. So all these different jurisdictions kind of tend to create very fragmented systems in our mental health services, and substance use services is no exception to that. We also know that mental health issues have been exacerbated during COVID. We know that prior to the pandemic, 1 in 5 of us experienced a mental health condition, so 20% of us, and now that number has escalated to 40%. So mental health issues have been a long time concern for the Tahoe Truckee community. They've been exacerbated. as a result of the pandemic. That's not unique to our region. However, as a collaborative and as a collective, we certainly have an opportunity to address the issues that we're seeing at a local level. Next slide, Christina. So like I said, mental health has been a long-standing community issue for us as a region. So as a result, the collaborative has spent quite a bit of time in this space. And so when I talk about the collaborative, I mean all of us together. So we've done a lot of different things together. We have convened our partners. We've talked with many of you. You've all talked to each other around how to address our mental health issues. We've tracked specific data points in partnership with many of you, reflecting the mental health and substance use disorder needs of youth and families in our region. And we've also done quite a bit of advocacy. We have produced issue briefs focused specifically on mental health. We've worked to leverage funding from not only a government perspective, but also some outside foundations to really help address this ongoing mental health challenge. And we've seen tremendous growth with our partners. You've all done an amazing job of really being responsive to the mental health needs of our community. You've all been very responsive and expanded programs to help meet our mental health needs. And yet, despite all this work that we've done as a community and as a collective, we recognize that behavioral health continues to be a challenge. So we've had an opportunity to partner with an organization and a foundation called the Katz Amsterdam Charitable Trust. And so Rob Katz, who is the former CEO of Vail Resorts and is now the executive chairperson, began a family foundation about 5 years ago with his partner. And they are funding specifically, well, they've actually kind of branched out to fund other things, but one of the things that they do fund is mental health and substance use disorder organizations and issues in the communities where they operate Vail Resorts. And so many of you know, Vail Resorts operates North Star, and they also run Heavenly in South Lake Tahoe. So the Katz Amsterdam Charitable Trust has supported many of the organizations that are on this call today with mental health and substance use disorder services, ranging from our Promotora program that you all provide and support to some substance use disorder services. So they funded all sorts of different programs, and they're also interested in funding some more strategy work. So we began a conversation with them a number of years ago, and they expressed interest in basically funding almost a behavioral health strategic plan specific to the Tahoe Truckee region. So not an organization specific one, but a regional wide strategic plan. So in early 2020, maybe late 2019, we talked with many of the folks on this call. We talked about it at this forum, at other collaborative meetings, around this idea of doing what we just ended up calling a roadmap. So we worked in partnership with both counties, the school district, many of you on the call, to really inform the process and basically implement the roadmap and execute the roadmap. And so what I'm doing today, what I'd like to do is share the findings, which again, some of you have seen before, and also solicit feedback on the findings and kind of do a temperature taking, like, are we on the right track? Do these findings seem accurate to you? Are we missing something? And just get some overall feedback. Next slide, Christina. So some background on the actual report, and Christina's going to go ahead and drop it in the chat box so you can take a look at it as well if you'd like to read along, is that we spent much of early 2020 putting ourselves in a place of readiness to launch the roadmap. So we conducted a community-wide behavioral health survey in early 2020, which asked the community their perspective on mental health, substance use, their experiences accessing services. And we're actually in the process of just launching the survey again. This survey was funded by the Katz Amsterdam Charitable Trust. So we'll talk about that at the end of this portion of the agenda. And we also worked with the hospital. So I saw Lizzie and Maria on the call to survey our providers in the area on what their experience is providing services to our region. And then we also worked with many of you on the call to actually develop the RFP and conduct an interview process to hire a consultant to launch the roadmap. And so again, much of 2020 was spent on kind of this place of readiness. Next slide, Christina. So the overall purpose of the roadmap was to really understand our region's behavioral health challenges and resources around mental health and substance abuse and use. We really wanted to identify future strategies for improvement and ultimately leverage resources for the region and really work to create change so that we could, again, address one of the most pressing community issues that we have seen as a collaborative. Next slide, please. The methodology that we used, there was a couple different phases. The first phase was a data scan. So we looked at all the data that many of you collect. We looked at the behavioral health survey that I mentioned that solicited feedback from several hundred community members. We looked at the California Healthy Kids survey data operated by the school district. The hospital produces a community health needs assessment, so we drew some data from that. We also drew some data from the provider survey that I mentioned, and our consultant that we worked with conducted about, I think, almost 15 key informant interviews. So folks who are consumers, folks who are decision makers, policy makers, frontline providers, to really get a sense of what folks are seeing around behavioral health overall. The second phase was phase 2, which we called, we conducted some data parties where we shared all the data that we collected in about 5 or 6 different data parties, where we invited many of you to say, hey, what do you think about these findings? What are some solutions? What are some feedback around these initial findings? And then we also conducted case studies. So we looked at communities that had similarities to ours. So whether similar demographics, similar geographies, similar behavioral health issues in general, and kind of pulled from those case studies best practices and what worked in those other communities. So we ultimately looked at Humboldt County, Napa County, and Sonoma County. And then we had a design team that helped inform the process that was comprised of county staff. So Jasmine was a regular participant, as well as collaborative staff as well, to help guide the process. So that was the methodology to the findings that I will share with you shortly. Next slide, Christina. So what did we find out? Overall, at a very high level, and again, the report, if you care to look, is chock full of data. But we know that less than half of us believe it's easy to talk about mental health. More than 2/3 of respondents, our data shows, say that their lives have been negatively impacted by substance abuse. 43% of us are found to be excessive drinkers, compared to the national average of 18%. More than half of the providers that responded to the survey do not take insurance. And of the providers, when we did the survey in 2020 that took insurance, none provided services in Spanish. Next slide, Christina. So that was some of the key findings that helped drive the roadmap. And how we're using the roadmap, so how we're using the key findings, some of the key data points and again, I'm about to launch into the actual findings, so thank you for your patience. Is that our goal is to share this work with our broader collaborative, with the community in general, again, ultimately leverage funding and resources to our priorities. We want to ensure that we are focused on equity and that we're ultimately able to use this work and our work as a collective to drive change. So that's kind of our overall goal in general. Our goal for today, next slide, please, Christina, is to share the findings and priorities with you all, like I've said, and to, again, just solicit feedback on the solutions, what resonates, are we on the right track, do a temperature taking. We really want to ensure that if we've missed anything, again, this was conducted about a year ago, so if there's any new solutions that have emerged, we would love to hear that from you all. We want to ensure, again, that our solutions and the work that we're doing is rooted in equity. And we also want to hear from you all at some point, who else you think could benefit from hearing this information? Are there groups that you all work with? Are your organizations, your board of directors, anybody else in the broader community who you think could help leverage and drive change and would be interested in hearing the findings from our roadmap? And what you will all have an opportunity to do, and we'll talk about this more in a little bit, is as I go through the findings, we have about 10 key priority areas. You will have an opportunity to go into small group breakouts and provide very specific feedback on 3 of those areas. And so we'll talk more about that process. But as I go through the findings, just please keep in mind, oh my gosh, I'd love to understand that issue more. Or I'd love to talk more about those solutions. And you can even jot those down, because again, we'll have an opportunity to do rotations of 3 small groups. Okay, next slide, Christina. So here is our roadmap. These are our key findings. So we basically have 4 priority areas that I'm going to talk through each one. The first priority is policy and funding. So focusing solutions on a policy funding level. The second is programs and services. So what do we have to do around our programs and services to ensure that our community has access to a comprehensive system of support? The third priority area is around connections and community. So what do we need to focus on at a community level? How do we work more strategically across our collaborative efforts? And then the fourth area is what we're currently calling field building and inclusivity. So how do we ensure that we have a diverse workforce that is able to live and provide services in the Tahoe Truckee area, and if not, provide services to the Tahoe Truckee area residents. So those are our key priority areas that I'm about to walk through. Next slide, please. So our first key priority area is around addressing financial and insurance barriers. And so my caveat before I present this information is that each slide will briefly address the issue. Some of the issue areas have kind of short-term solutions and some are longer-term solutions. And then we've included a data point at the bottom of each slide. It's a lot of information on each slide. So that's why we're sharing the report with you in the chat box. We will share the graphic with you in the chat box. And again, you'll have an opportunity to break into small groups to kind of take a deeper dive into each of these areas. So I'm going to go through each slide, but again, I'm not going to hit on every point because it's a ton of information, and I really want to make sure that we have time to kind of dive deeper in small groups. And again, all these solutions are ideas that we've heard from many of you, your colleagues, your partners, best practices across the state of California. But that's just a little information on each slide or what you'll be seeing. So the first area is to address financial and insurance barriers is that few local providers accept private or Medi-Cal insurance due to cost prohibitive and complicated reimbursement processes. So what we know is that many providers don't accept insurance because it simply doesn't pencil out to accept insurance. And so many of our providers often only accept private pay, which is very cost prohibitive to many local residents. So there's some short-term solutions that have been identified, as well as some longer-term solutions in this area. So the first short-term solution is to support hiring a youth therapist through a shared funding model. So there's been multiple conversations, and I know Jasmine's on the call who could articulate this much more clearly than I could, but with the county, the school district, the hospital, like, is there a way to creatively support and fund a youth therapist to help address some of the needs? And then the second piece is to offer technical assistance to providers to help navigate the insurance billing process. Again, like it takes quite a bit of capacity to build like the muscle to bill insurance. And so is there a way that we could help leverage some funding to provide that technical support to help our providers be in a place of readiness to bill insurance? There's some longer term strategies around advocacy with managed care providers. Is there innovative ways to include providers in group insurance policies? And then because telehealth has really expanded as a result of the pandemic, and we've been able as a collective to kind of reduce some of the stigma around accessing mental or telehealth, and we know that telehealth doesn't work for everybody in all situations. However, because of the expansion of telehealth, is there any way to leverage some of that work? So that is the first area. Next slide, Christina. So the second area is to harness flexible and responsive funding. So we know that county government provides mental health services to residents who income qualify with the most severe mental health challenges. So thank you to our county partners for being on the call today. And that we know that there's also public dollars to help kind of augment some of those services. So if I think about like some of the Mental Health Services Act funding stream dollars that come through to support some community services that support a lot of the costs, but don't necessarily cover the full cost, and that we tend to have a funding gap. And we know that philanthropy in general, like a very small percentage of philanthropy actually goes to mental health services. So how do we as a collective help leverage some of that private philanthropy to mental health services to create a robust continuum of care? And how do we ensure that public dollars are getting to the services that work most effectively and that could use them best? So short-term solutions, how do we harness more flexible private funding, like I said? Is there a way to utilize federal COVID dollars to launch new programs that can be sustained through other financial models? So again, like that was a solution that was identified about a year ago. So I know since that time that has taken place. So I know there's a number of services in place at the school district through social workers that wasn't in place over a year ago. So how do we help sustain that work that's been put in place as a result of relief dollars? And then again, how do we leverage this increased awareness around behavioral health? Like there's been many more articles and stories, and the awareness, I think, around behavioral health has increased as a result of the pandemic. And so how do we continue to work to address those increased needs, but also kind of work to leverage that awareness that maybe was not in place about a year and a half ago or 2 years ago? And then we talked a little bit about how do we create a kind of a mental health fund to support some of these ongoing issues that we see in the community. Okay, next slide, please, Christina. Okay, so our next solution area is really around programs and services. So the first area that we need to focus on as a collective is to focus on upstream prevention services and connections. And so we know that upstream programs for children and youth, such as school and community-based family and youth strengthening programs, kind of pay it forward and help reduce the potential harms and cost of treating more severe mental health impacts and trauma down the road. So we know that to be true. So how do we as a collective shore up the current programs that we have in place around prevention and work to address kind of some of the gaps that we have in prevention services? So we have some good things in place, and we need to, again, work to sustain those and address kind of our unmet needs. So the areas that have been identified or kind of the populations are around early childhood development, our school-based wellness programs and services, youth peer leadership development services, as well as youth mentoring services. We've talked a lot lately over the past year, 2 years, about youth connection and engagement. So how do we as a community provide more creative opportunities to bring folks together, whether it's youth or seniors? And we've talked a lot about kind of doubling down on the parent cafe model, which is specifically geared towards parents and providing connection and engagement for parents. Next slide, Christina. So the next area under programs and services is to enhance our substance use disorder services. So we know that drug and alcohol use and abuse rates are higher in Tahoe, Truckee compared to our state and national benchmarks. We also know that there's not enough local services to meet the current need, and that oftentimes our residents have to travel out of the Tahoe, Truckee area to access inpatient residential services as well as other critical needs, which basically pulls them out of their community and their community of support. We also know that our local outpatient services are understaffed and underfunded. And again, like the insurance systems are really complex around substance use disorder. So how do we overall help just bolster our substance use disorder services and system in general? So one of our primary areas is how do we help support the local organizations we have in place? Is there a way to expand some group options so that folks can access services through group modalities and more than what we currently have in place? And there's certainly some longer term solutions that we've talked about for a long time, but how do we strategically collaborate specifically around substance use disorder services? And how do we, again, work on more flexible funding mechanisms to address this really critical issue? Okay, next slide, Christina. So the final kind of program and service area that has been identified is to explore mobile crisis services. So we know that the issue is that calling law enforcement or going to the emergency room are often the only options to provide immediate assistance to individuals experiencing a mental health crisis. So we know that at times it is certainly necessary for individuals in crisis to receive services through the emergency room. But we also know that this can often overtax emergency rooms as well as law enforcement. It may not be the most consumer friendly way of receiving crisis intervention services. So how do we as a community really come together to address our crisis services? So there is currently a pilot program in place, and really kind of our short-term solution is to assess at the end of this fiscal year, is our pilot program working? Is it not working? And what do we need to do to double down on our mobile crisis services in general? And then again, just determine gaps in system and funding options. So we've talked a lot about mobile crisis response services. And I think we are making headway. And so I look forward to really establishing some longer term solutions in this area. Next slide, Christina. Okay, so our next kind of bucket of solution areas is under connections and communities. So the first one is strategically collaborate to create a regional behavioral health system. So I feel like the counties, the hospital, the school district, and many of the nonprofits at the table have done a really phenomenal job coming together. There's been multiple programs through both Placer and Nevada County that have been funded across county lines. Priya, I look at you for the Nevada County Mental Health Services Act planning process, and Sue for the Placer County Mental Health Services Act process, who've done some really innovative partnering to bring county funding together and leverage county funding and address community needs as a whole. And I think we can continue this work through the mental health task force. We pull our partners together in a behavioral health meeting on a quarterly basis. So how do we just continue that good work that's already been started? And again, I think there's just much opportunity in all the different areas to work even more collaboratively together. Next slide, please, Christina. The other issue that's been identified is to really address the root causes of behavioral health. And so we know that there's many external factors that impact behavioral health in addition to genetics and pre-existing conditions. We've talked a lot about toxic stress, which is caused by poverty, housing, food insecurity, fear of immigration authorities, and the threat of catastrophic forest fires. And we know that those can all lead to anxiety or depression and exacerbate any underlying behavioral health issues. And we also know that we have significant disparities in our region and that our socioeconomically disadvantaged residents experience worse mental health outcomes than our non-socially economically disadvantaged residents. So how do we, again, work together to address these root causes and really address some of the disparities? So short-term solutions that have been identified is how do we fund and sustain our safety net services? So housing services, legal services, food insecurity services. How do we support poverty reduction efforts, including the earned income tax credit, as well as other child tax credits and financial literacy programs? And then how do we work to support the good work that's been happening through the ACEs Aware community and through our local ACEs network to address the impacts of early trauma, and also work to really increase awareness of the effects of early trauma. Next slide, Christina. Okay, so the final kind of priority area under connections in the community is to address mental health stigma. And so we know that mental health is no different than physical health, and everyone needs expert support from time to time to really help ensure optimum mental health. And we also know that there's very high rates of stigma around accessing mental health, which can often prevent folks from trying to seek out services or actually following through with getting services. So we have some short-term solutions, which are really around identifying stigma reduction campaigns. We've done some work in the Tahoe Truckee community around stigma reduction campaigns. There's some other good work that we can pull from our partner communities, specifically in other rural mountain towns. How do we expand successful school-based services to decrease stigma experienced by youth and their families? And then how do we expand the bilingual peer-based services through the promotoras to destigmatize mental health among our Latinx community members? And then I think a long-term solution is to really continue this conversation around destigmatizing mental health and share it with the broader community and pull the community in to help that conversation. Next slide, please. So our final kind of bucket of priorities is around field building and inclusivity. So there's two areas that have been identified. One is to expand services to our Spanish-speaking community members. So we know overall that our Spanish-speaking population has too many gaps in all of our behavioral health services and all along the continuum. So we need more Spanish-speaking providers and programs, and really we need to work to sustain what can be at times some piecemeal funding. So short-term solutions that have been identified: sustain our peer-certified promotor program, explore and promote telehealth options for culturally responsive bilingual and bicultural behavioral health services by partnering with agencies providing telehealth services outside of the region. And then not only work to build up services, but how do we help support the navigation of services? So support our promotora team to assist the Latinx community members to navigate telehealth options. And then long-term solution is to really develop strategies to build the bilingual and bicultural workforce. Next slide, please, Christina. So our final area under field building and inclusivity is to improve our workforce recruitment, retention, and development. And so there are simply not enough providers to provide a comprehensive system of behavioral health support to the community. And we know that this is not an issue specific to our region. We know that many of the issues that we've talked about today are not specific to Tahoe Truckee, and this one certainly. It's a statewide issue, it's a nationwide issue. And again, I always go back to what can we do at a local level and what power do we have as a broader collaborative in addressing some of these issues. So we've talked about incentive payments to fill vacant positions. There's been some solutions identified around identifying opportunities to expand peer-based counseling services. So again, kind of bolstering the continuum of mental health services and substance use services along the way. And then for longer term solutions, how do we just really, again, work to identify longer term recruitment and strategies and retention strategies. How do we strategically partner with managed care plans to hire and offer incentive payments for staff who can serve those who have a serious mental illness and those with mild to moderate symptoms, and consider a grow your own intern program to create professional pathways. So again, some like very high level solutions that really require some pretty significant work to make sure that we can kind of move the needle in this area. Okay, next slide, please, Christina. Okay, so that is a very high level overview of the key priority areas and the solutions identified under each of the priorities. We're going to have a moment to break out into small groups in about 5 minutes. But before we do, I just wanted to say I really recognize that these are very high level solutions, and that we are excited about the opportunity to really move the needle on some of these solutions. And at the same time, it will definitely take some feedback from you all, like where can we focus our energy as a collaborative? Like what are some specific tactical short-term solutions, long-term solutions? And so in a few minutes, you'll have an opportunity to really kind of, again, dive deeper into each of these priority areas in small groups. But what we're going to do for the meantime is we're going to take a 5-minute break so we can talk with our facilitators and talk about how these small groups will work. Again, we've done similar things like this in person before. This is our first time, to be totally frank, doing like this many small groups in a virtual setting. So we want to make sure that we have our technology dialed before we all invite you all back to participate in small groups. So right now it's 10:50. So everyone has a 5-minute break. Facilitators are going to ask that you stay on for a couple minutes, and then you can have a few minute break as well before we get launched. So we will get rolling again at 10:55. Back. Welcome back. I hope everybody had an opportunity to share some feedback, perspective. If you did not have an opportunity, we can provide the Padlet links again, or you can just email Christina or I, or chat us or call us. Like, we really want to ensure that you all have an opportunity to be heard during this feedback process. And I also would love to hear at some point, you can just email me or put in the chat box now, who else we could share this information with. We've presented a more truncated version of the roadmap to the Community Foundation Board, who is interested in kind of funding priority areas. We are happy to share with any other community groups and can share like shorter versions, longer versions, whatever detail folks are needing or wanting. So we really appreciate everyone's participation. And again, it was the first time we've done it this way. We've done this many small groups. And so thank you so much to our facilitators. And we know the technology was a little clunky and challenging. So we just really appreciate your willingness to even show up for the conversation and help guide it. So thank you so much. Okay, so Christina, I'm looking at you, Christina. We're gonna skip ahead to our resource sharing. And Jasmine, I believe we're starting with you. Is that correct? And my caveat is I just got back from vacation like at 11 o'clock last night, so I'm really behind on email. So if I'm missing anything else, Christina, around like logistics of this part of the meeting, please jump in. But I believe I'm turning it over to Jasmine.
Sure. When did you want me to flash the behavioral health survey? Do you want to do that first?
Let's do that after Jasmine.
Okay, perfect.
Great. So I'm here for your regular scheduled COVID county update. I was just thinking I'm going to be so grateful when we are no longer doing COVID updates. Probably not anytime soon, but I am really grateful and excited for that day. But I'm going to keep it short and sweet today. Our case rates with Placer, Nevada County and the state continue to go down. Hospitalizations continue to go down. We do continue to have widespread disease transmission, and our current case rates are still 2 times the number that would place the county in the purple tier when we had the state blueprint for safer economy last year. So continue to be vigilant. We just hit our 2-year anniversary of COVID in our lives. And, a lot of messaging has been coming out around mask guidance, mask mandates, lots of confusing messages in the media. So I just wanted to go over this quick 2 visuals. Christina, if you wouldn't mind sharing your screen, just so everyone can have a better understanding of how to make determinations on mask or not mask. So masks continue to reduce your chance of getting COVID-19. That the efficiency and effectiveness of wearing masks has not changed. So you can see kind of the no mask all the way up to cloth mask, surgical mask, and respirator mask, and kind of the percentage of protection that you have by wearing that mask against getting COVID-19. Christina, next slide. All right, and so this is kind of the second little tier to look at. So depending on your risk in the community that you are in, these are the additional kind of masking guidelines. So if you're in a high risk community like Nevada County or Placer County, the recommendation is to wear a mask. It doesn't mean that it is mandated to wear a mask. And then continue to get tested. And if you are high risk, if you have more vulnerabilities at risk of illness or in kind of high density areas with lots of people, continue to consider wearing masks. And then when you go towards the medium and the lower tier, the recommendations change as far as wearing a mask or not indoors. So that's the short and sweet. Does anyone have any questions, or what reactions do people have to masking and COVID updates?
My reaction is that I'm hopeful. Go ahead.
It looks like Lisa Stecker put a question in the chat of, do you know where someone can get Johnson & Johnson in the region? I don't know, but I do know that if you go on to the website to schedule your appointment, My Turn, I believe that you can select what vaccine your preference is, and then it will match you with appointments that you have available.
Any other questions for Jasmine?
How can we track online which areas are low, medium, or high in the state or nationwide?
Yeah, so each county maintains their COVID dashboard. So Nevada County, Placer County has their case rates and kind of all of that. And then I believe there might also be a state-run website that shows case rates per county. But going to your individual county website would give you the most up-to-date local statistics.
Any other questions? Okay.
Thank you. Katie just put a helpful link in the chat.
There was also a question from Kevin Tomlin. He heard that there's been a shortage of at-home tests, and are we planning to see more of these tests?
Yeah, I don't know. There continues to be efforts at a national level to make testing and masking and vaccines available to the community. So we get information from the state and the federal government on if the counties will be receiving more home tests. And it kind of happens at very short notice, and then the counties disperse those to the school districts and different priority areas. So there's a vague answer for you, Kevin.
Thank you. Okay, any other? Okay, so Katie put a link where there's still free tests. Thank you. Appreciate that. Okay, any other questions or comments for Jasmine?
I'm just going to make a comment to Jasmine and Devin. TGUSD, they're going to unmask the kids on 14th. That's the plan as well, so it's pretty good. I haven't read up too much on it, but things to think about for kids, and they're comfortable with it and what that looks like. And I imagine it's going to be pretty steep transition for a lot of kids. And some will be celebrating and dancing, and others will be like clamoring in the corners, like, oh, so pretty wild news.
Yeah, it's big news for sure. Thank you, Devin.
Yeah.
And more to come, and we'll definitely continue to push COVID information out. Like Jasmine said, this probably is not her last update, but thank you for that. And we'll make sure we include the information about the school as well in our next bulletin. So Christina, would you mind just flashing on your screen really quickly about the behavioral health survey? And so very quickly, like I mentioned a little while ago, we are launching another community engagement survey to kind of poll the community on questions around mental health, substance abuse, community engagement. Again, like I said, this is being done in support from the Katz Amsterdam Foundation, and we are doing this in partnership with 3 other mountain towns. And so Eagle County in Colorado, which is Vail, Summit County in Colorado, which is Breckenridge, and then actually Jackson, Wyoming, and Summit County, Utah, just did a community survey. So we'll have some benchmark comparison data to not only our own benchmark data from 2 years ago, but these other mountain communities. And so this year, which is different than when we did it in 2020, is that there's a QR code available. So if you take a picture of the code, it will pop up, you'll have the option to open up the survey in Internet Explorer. And so we really encourage you to take about 10, 15 minutes to take the survey. I just did it. I just opened up the survey. And then when you open it on your phone, you have the opportunity to answer the survey in English or Spanish. And so it really behooves us to capture input from as much of our community as possible. So please help pass this on to friends, families, colleagues. And it will be open for the next 4 weeks, Christina, I believe, and we'll send out more information specifically in the bulletin. So thank you so much. Okay, so now I'd like to open it up to any other partner updates. You can go ahead and raise your hand, so you can click on the emoji. Kayla, I see you, and then Natalie, I see you, and anybody else can raise their hand. And then we'll go to you, Felicity. So we'll start with you, Kayla, and then Natalie, then Felicity.